Hi guys, Dr. Sammy here. Today's question, one of the clients had asked, can my dog get pink eye? So sometimes a lot of things look like pink eye. I'm not too familiar with pink eye specific diagnosis in dogs, but there are a lot of things that look very similar that clients would commonly come in and describe as, my dog has pink eye. So we'll kind of go under the pretense of yes, but not exactly. So, can your dog get some inflammation and irritation around the eye? Yes, absolutely. We do see a lot of conjunctivitis and uveitis, and you get a little bit different causes for those, and they look a little bit different, but to the untrained eye, it'd probably look very, very similar. So the conjunctivitis is going to be that pink fleshy stuff that's around your eye. So whenever you get conjunctivitis, this pinkish tissue is called the conjunctiva. And then itis is the Latin root for inflammation, irritation. So conjunctivitis, inflammation of the conjunctiva is what that means. So most clients will probably call conjunctivitis pink eye. So some of the things we kind of do with that depends on the cause. Every patient's different. There are some breed predispositions where things can look very similar to conjunctivitis, but it's actually a different problem altogether. We're not going to focus on that today. For the most part, every clinic does it different, every doctor does it different. Generally, what most people will do is they'll do what's called a fluorescein stain, so it's a bright chartreuse color that we'll put drops in the eye, and then we put a black light under it, and we look for corneal ulcers or trauma to the eye and that kind of thing. There are some other tests that we can run, like Schirmer tear tests, eye pressures, and so on. But for most doctors, most will probably run the fluorescein stain, look for a corneal ulcer, then pending that result, that'll change our treatment a little bit from anti-inflammatories to antibiotic only. If we have an underlying ulcer, we usually need to manage for secondary infection, because the worst thing that can happen is that ulcer gets out of control and gets bigger and bigger and bigger. And then if it gets deeper and deeper, you can actually rupture the eye, and there is a point of no return at some point. If the eye ruptures, you kind of get a desmetacel is what they're called, where you have one cell layer left of the cornea, corneal tissue. And then once that ruptures, you're talking about maybe going to the eye specialist. They might be able to do a couple things to rescue and salvage the eye. The vast majority of the time, we end up doing an enucleation and take that eyeball out, because it is very, very painful for our fur babies. So hopefully that helps a little bit, and try not to get pink eye or conjunctivitis. All right, guys, be safe, and thanks for joining. Take care.